NCLEX Practice Exam for Respiratory System 1. Question 1. The nurse is caring for a male client with a chest tube. If the chest drainage system is accidentally disconnected, what should the nurse plan to do? A. Place the end of the chest tube in a container of sterile saline. B. Apply an occlusive dressing and notify the physician. C. Clamp the chest tube immediately. D. Secure the chest tube with tape. Answer A. If a chest drainage system is disconnected, the nurse may place the end of the chest tube in a container of sterile saline or water to prevent air from entering the chest tube, thereby preventing negative respiratory pressure. The nurse should apply an occlusive dressing if the chest tube is pulled out, not if the system is disconnected. The nurse shouldn't clamp the chest tube because clamping increases the risk of tension pneumothorax. The nurse should tape the chest tube securely to prevent it from being disconnected, rather than taping it after it has been disconnected. Question 2. A male elderly client is admitted to an acute care facility with influenza. The nurse monitors the client closely for complications. What is the most common complication of influenza? A. Septicemia B. Pneumonia C. Meningitis D. Pulmonary edema. Answer B. Pneumonia is the most common complication of influenza. It may be either primary influenza or viral pneumonia or pneumonia secondary to a bacterial infection. Other complications of influenza include myositis, exacerbation of the chronic obstructive pulmonary disease, and RIS syndrome. Myocarditis, pericarditis, transverse myelitis, and encephalitis are rare complications of influenza. Although septicemia may arise when any infection becomes overwhelming, it rarely results from influenza. Meningitis and pulmonary edema aren't associated with influenza. Question 3. A female client has a tracheostomy but doesn't require continuous mechanical ventilation. When weaning the client from the tracheostomy tube, the nurse initially should plug the opening in the tube for A. 15 to 60 seconds B. 5 to 20 minutes C. 30 to 40 minutes D. 45 to 60 minutes. Answer B. Initially, the nurse should plug the opening in the tracheostomy tube for 5 to 20 minutes, and then gradually lengthen this interval according to the client's respiratory status. A client who doesn't require continuous mechanical ventilation already is breathing without assistance, at least for short periods. Therefore, plugging the opening of the tube for only 15 to 60 seconds wouldn't be long enough to reveal the client's true tolerance to the procedure. Plugging the opening for more than 20 minutes would increase the risk of acute respiratory distress because the client requires an adjustment period to start breathing normally. Question 4. Gina, a home health nurse, is visiting a home care client with advanced lung cancer. Upon assessing the client, the nurse discovers wheezing, bradycardia, and respiratory rate of 10 breaths a minute. These signs are associated with which condition? A. Hypoxia B. Delirium C. Hyperventilation D. Semiconsciousness. Answer A. As the respiratory center in the brain becomes depressed, hypoxia occurs, producing wheezing, bradycardia, and a decreased respiratory rate. Delirium is a state of mental confusion characterized by disorientation to time and place. Hyperventilation, a respiratory rate greater than that metabolically necessary for gas exchange, as marked by an increased respiratory rate or tidal volume, or both. Semiconsciousness is a state of impaired consciousness characterized by limited motor and verbal responses and decreased orientation. Question 5. A male client with Guillain-Barré syndrome develops respiratory acidosis as a result of reduced alveolar ventilation. Which combination of arterial blood gas ABG values confirms respiratory acidosis? A. pH 5.0, PaCO 2, 30 mm Hg. B. pH 7.40, PaCO 2, 35 mm Hg. C. pH 7.35, PaCO 2, 40 mm Hg. D. pH 7.25, PaCO 2, 50 mm Hg. Answer D. In respiratory acidosis, ABG analysis reveals an arterial pH below 7.35 and partial pressure of arterial carbon dioxide PaCO2 above 45 mm Hg. Therefore, the combination of a pH value of 7.25 and a PaCO2 value of 50 mm Hg confirms respiratory acidosis. A pH value of 5.0 with a PaCO2 value of 30 mm Hg indicates respiratory alkalosis. Options B and C represent normal ABG values, reflecting normal gas exchange in the lungs. Question 6. A female client with interstitial lung disease is prescribed prednisone Deltasone to control inflammation. During client teaching, the nurse stresses the importance of taking prednisone exactly as prescribed and cautions against discontinuing the drug abruptly. A client who discontinues prednisone abruptly may experience A. Hypoglycemia and glycosuria. B. Acute adrenocortical insufficiency. C. GI bleeding. D. Restlessness and seizures. Answer B. Administration of a corticosteroid such as prednisone suppresses the body's natural cortisol secretion, which may take weeks or months to normalize after drug discontinuation. Abruptly discontinuing such therapy may cause the serum cortisol level to drop low enough to trigger acute adrenocortical insufficiency. Hypoglycemia, glycosuria, GI bleeding, restlessness, and seizures are common adverse effects of corticosteroid therapy, not its sudden cessation. Question 7. A male client is admitted to the healthcare facility for treatment of chronic obstructive pulmonary disease. Which nursing diagnosis is most important for this client? A. Activity intolerance related to fatigue. B. Anxiety related to actual threat to health status. C. Risk for infection related to retained secretions. D. Impaired gas exchange related to airflow obstruction. Answer D. A patent airway and inadequate breathing pattern are the top priority for any client, making impaired gas exchange related to airflow obstruction the most important nursing diagnosis. The other options also may apply to this client but are less important. Question 8. A male client abruptly sits up in bed, reports having difficulty breathing and has an arterial oxygen saturation of 88%. Which mode of oxygen delivery would most likely reverse the manifestations? A. Simple mask. B. Non-rebreather mask. C. Face tent. D. Nasal cannula. Answer B. A non-rebreather mask can deliver levels of the fit fraction of inspired oxygen FiO2 as high as 100%. Other modes, simple mask, face tent and nasal cannula, deliver lower levels of FiO2. Question 9. A male adult client with cystic fibrosis is admitted to an acute care facility with an acute respiratory infection. Prescribed respiratory treatment includes chest physiotherapy. When should the nurse perform this procedure? A. Immediately before a meal. B. At least 2 hours after a meal. C. When bronchospasms occur. D. When secretions have mobilized. Answer B. The nurse should perform chest physiotherapy at least 2 hours after a meal to reduce the risk of vomiting and aspiration. Performing it immediately before a meal may tire the client and impair the ability to eat. Percussion and vibration, components of chest physiotherapy, may worsen bronchospasms. Therefore, the procedure is contraindicated in clients with bronchospasms. Secretions that have mobilized, especially when suction equipment isn't available, are a contraindication for postural drainage, another component of chest physiotherapy. Question 10. On arrival at the intensive care unit, a critically ill female client suffers respiratory arrest and is placed on mechanical ventilation. The physician orders pulse oximetry to monitor the client's arterial oxygen saturation in SO2 non-invasively. Which vital sign abnormality may alter pulse oximetry values? A. Fever. B. Tachypnea. C. Tachycardia. D. Hypotension. Answer D. Hypotension, hypothermia, and vasoconstriction may alter pulse oximetry values by reducing arterial blood flow. Likewise, movement of the finger to which the oximeter is applied may interfere with interpretation of SO2. All of these conditions limit the usefulness of pulse oximetry. Fever, tachypnea, and tachycardia don't affect pulse oximetry values directly. Question 11. The nurse is caring for a male client who recently underwent a tracheostomy. The first priority when caring for a client with a tracheostomy is A. Helping him communicate. B. Keeping his airway patent. C. Encouraging him to perform activities of daily living. D. Preventing him from developing an infection. Answer B. Maintaining a patent airway is the most basic and critical human need. All other interventions are important to the client's well-being but not as important as having sufficient oxygen to breathe. Question 12. For a male client with chronic obstructive pulmonary disease, which nursing intervention would help maintain a patent airway? A. Restricting fluid intake to 1,000 milliliters/day. B. Enforcing absolute bed rest. C. Teaching the client how to perform controlled coughing. D. Administering prescribed sedatives regularly and in large amounts. Answer C. Controlled coughing helps maintain a patent airway by helping to mobilize and remove secretions. A moderate fluid intake, usually 2 liters or more daily, and moderate activity help liquefy and mobilize secretions. bed rest and sedatives may limit the client's ability to maintain a patent airway, causing a high risk of infection from pooled secretions. Question 13. The amount of air inspired and expired with each breath is called A. Tidal volume, B. Residual volume, C. Vital capacity, D. Dead space volume. Answer A. Tidal volume is the amount of air inspired and expired with each breath. Residual volume is the amount of air remaining in the lungs after forcibly exhaling. Vital capacity is the maximum amount of air that can be moved out of the lungs after maximal inspiration and expiration. Dead space volume is the amount of air remaining in the upper airways that never reaches the alveoli. In pathologic conditions, dead space may also exist in the lower airways. Question 14. A male client with pneumonia develops respiratory failure and has a partial pressure of arterial oxygen of 55 mm Hg. He is placed on mechanical ventilation with a fraction of inspired oxygen FiO2 of 0.9. The nursing goal should be to reduce the FiO2 to no greater than A. 0.21, B. 0.35, C. 0.5, D. 0.7. Answer C. An FO2 greater than 0.5 for as little as 16 to 24 hours can be toxic and can lead to decreased gas diffusion and surfactant activity. The ideal oxygen source is room air FiO2 0.18 to 0.21. Question 15. Nurse Mickey is administering a purified protein derivative PPD test to a homeless client. Which of the following statements concerning PPD testing is true? A. A positive reaction indicates that the client has active tuberculosis TB. B. A positive reaction indicates that the client has been exposed to the disease. C. A negative reaction always excludes the diagnosis of TB. D. The PPD can be read within 12 hours after the injection. Answer B. A positive reaction means the client has been exposed to TB. It isn't conclusive of the presence of active disease. A positive reaction consists of palpable swelling and in duration of 5 to 15 millimeters. It can be read 48 to 72 hours after the injection. In clients with positive reactions, further studies are usually done to rule out active disease. In immunosuppressed clients, a negative reaction doesn't exclude the presence of active disease. Question 16. Nurse Murphy administers albuterol as prescribed to a client with emphysema. Which finding indicates that the drug is producing a therapeutic effect? A. Respiratory rate of 22 breaths minute. B. Dilated and reactive pupils. C. Urine output of 40 milliliters/hour. D. Heart rate of 100 beats minute. Answer A. In a client with emphysema, albuterol is used as a bronchodilator. A respiratory rate of 22 breaths minute indicates that the drug has achieved its therapeutic effect because fewer respirations are required to achieve oxygenation. Albuterol has no effect on pupil reaction or urine output. It may cause a change in the heart rate, but this is an adverse, not therapeutic, effect. Question 17. What is the normal pH range for arterial blood? A. 7 to 7.49. B. 7.35 to 7.45. C. 7.50 to 7.60. D. 7.55 to 7.65. Answer B. A pH less than 7.35 is indicative of acidosis. A pH above 7.45 indicates alkalosis. Question 18. Before weaning a male client from a ventilator, which assessment parameter is most important for the nurse to review? A. Fluid intake for the last 24 hours. B. Baseline arterial blood gas ABG levels. C. Prior outcomes of weaning. D. Electrocardiogram ECG results. Answer B. Before weaning a client from mechanical ventilation, it's most important to have baseline ABG levels. During the weaning process, ABG levels will be checked to assess how the client is tolerating the procedure. Other assessment parameters are less critical. Measuring fluid volume intake and output is always important when a client is being mechanically ventilated. Prior attempts at weaning and ECG results are documented on the client's record, and the nurse can refer to them before the weaning process begins. Question 19. Which of the following would be most appropriate for a male client with an arterial blood gas ABG of pH 7.5, PaCO 226 mm Hg, O2 saturation 96%, CO 324 mg/L, and PaO2 94 mm Hg? A. Administer a prescribed decongestant. B. Instruct the client to breathe into a paper bag. C. Offer the client fluids frequently. D. Administer prescribed supplemental oxygen. Answer B. The ABG results reveal respiratory alkalosis. The best intervention to raise the PaCO2 level would be to have the client breathe into a paper bag. All of the other options, such as administering a decongestant, offering fluids frequently, and administering supplemental oxygen, wouldn't raise the lowered PaCO2 level. Question 20. A female client is receiving supplemental oxygen. When determining the effectiveness of oxygen therapy, which arterial blood gas value is most important? A. pH. B. Bicarbonate CO3. C. Partial pressure of arterial oxygen PaO2. D. Partial pressure of arterial carbon dioxide PaCO2. Answer C. The most significant and direct indicator of the effectiveness of oxygen therapy is the PaO2 value. Based on the PaO2 value, the nurse may adjust the type of oxygen delivery cannula, Venturi mask, or mechanical ventilator, flow rate, and oxygen percentage. The other options reflect the client's ventilation status, not oxygenation. Question 21. Nurse Julia is caring for a client who has a tracheostomy and temperature of 103 degrees Fahrenheit 39.4 degrees Celsius. Which of the following interventions will most likely lower the client's arterial blood oxygen saturation? A. Endotracheal suctioning. B. Encouragement of coughing. C. Use of cooling blanket. D. Incentive spirometry. and endotracheal suctioning removes secretions as well as gases from the airway and lowers the arterial oxygen saturation SO2 level. Coughing and incentive spirometry improves oxygenation and should raise or maintain oxygen saturation. Because of superficial vasoconstriction, using a cooling blanket can lower peripheral oxygen saturation readings, but SO2 levels wouldn't be affected. Question 22. For a male client who has a chest tube connected to a closed water-sealed drainage system, the nurse should include which action in the plan of care? A. Measuring and documenting the drainage in the collection chamber. B. Maintaining continuous bubbling in the water-sealed chamber. C. Keeping the collection chamber at chest level. D. Stripping the chest tube every hour. Answer. The nurse should measure and document the amount of chest tube drainage regularly to detect abnormal drainage patterns, such as may occur with a hemorrhage if excessive or a blockage if decreased. Continuous bubbling in the water-sealed chamber indicates a leak in the closed chest drainage system, which must be corrected. The nurse should keep the collection chamber below chest level to allow fluids to drain into it. The nurse should not strip chest tubes because doing so may traumatize the tissue or dislodge the tube. Question 23. Nurse Eve formulates a nursing diagnosis of activity intolerance related to inadequate oxygenation and dyspnea for a client with chronic bronchitis. To minimize this problem, the nurse instructs the client to avoid conditions that increase oxygen demands. Such conditions include A. Drinking more than 1,500 milliliters of fluid daily. B. Being overweight. C. Eating a high-protein snack at bedtime. D. Eating more than 3 large meals a day. Answer B. Conditions that increase oxygen demands include obesity, smoking, exposure to temperature extremes, and stress. A client with chronic bronchitis should drink at least 2,000 milliliters of fluid daily to thin mucus secretions. Restricting fluid intake may be harmful. The nurse should encourage the client to eat a high-protein snack at bedtime because protein digestion produces an amino acid with sedating effects that may ease the insomnia associated with chronic bronchitis. Eating more than 3 large meals a day may cause fullness, making breathing uncomfortable and difficult. However, it doesn't increase oxygen demands. To help maintain adequate nutritional intake, the client with chronic bronchitis should eat small, frequent meals up to 6 a day. Question 24. A black male client with asthma seeks emergency care for acute respiratory distress. Because of this client's dark skin, the nurse should assess for cyanosis by inspecting their A. Lips. B. Mucous membranes. C. Nail beds. D. Earlobes. Answer B. Skin color doesn't affect the mucous membranes. The lips, nail beds, and earlobes are less reliable indicators of cyanosis because they're affected by skin color. Question 25. A female client with asthma is receiving a theophylline preparation to promote bronchodilation. Because of the risk of drug toxicity, the nurse must monitor the client's serum theophylline level closely. The nurse knows that the therapeutic theophylline concentration falls within which range? A. 1 to 2 mcg, ml. B. 2 to 5 mcg, ml. C. 5 to 10 mcg, ml. D. 10 to 20 mcg, ml. Answer D. The therapeutic serum theophylline concentration ranges from 10 to 20 mcg, ml. Values below 10 mcg, ml and therapeutic. Question 26. A male client is to receive IV vancomycin. When preparing to administer this drug, the nurse should keep in mind that A. Vancomycin should be infused over 60 to 90 minutes in a large volume of fluid. B. Vancomycin may cause irreversible neutropenia. C. Vancomycin should be administered rapidly in a large volume of fluid. D. Vancomycin should be administered over 1 to 2 minutes as an IV bolus. Answer A. To avoid a hypertensive reaction from rapid IV administration, the nurse should infuse vancomycin slowly, over 60 to 90 minutes, in a large volume of fluid. Although neutropenia may occur in approximately 5% to 10% of clients receiving vancomycin, this adverse effect reverses rapidly when the drug is discontinued. Question 27. Before seeing a newly assigned female client with respiratory alkalosis, the nurse quickly reviews the client's medical history. Which condition is a predisposing factor for respiratory alkalosis? A. Myasthenia gravis. B. Type 1 diabetes mellitus. C. Extreme anxiety. D. Narcotic overdose. Answer C. Extreme anxiety may lead to respiratory alkalosis by causing hyperventilation, which results in excessive carbon dioxide CO2 loss. Other conditions that may set the stage for respiratory alkalosis include fever, heart failure, an injury to the brain's respiratory center, overventilation with a mechanical ventilator, pulmonary embolism, and early salicylate intoxication. Type 1 diabetes mellitus may lead to diabetic ketoacidosis. The deep, rapid respirations occurring in this disorder. Kussmaul's respirations don't cause excessive CO2 loss. Myasthenia gravis and narcotic overdose suppress their respiratory drive, causing CO2 retention, not CO2 loss. This may lead to respiratory acidosis, not alkalosis. Question 28. At 11 p.m., a male client is admitted to the emergency department. He has a respiratory rate of 44 breaths a minute. He's anxious, and wheezes are audible. The client is immediately given oxygen by face mask and methylprednisolone dipomedrol IV. At 11:30 p.m., the client's arterial blood oxygen saturation is 86% and he's still wheezing. The nurse should plan to administer A. Alprazolam Xanax. B. Propranolol. C. Morphine. D. Albuterol. Answer D. The client is hypoxemic because of bronchoconstriction as evidenced by wheezes and a subnormal arterial oxygen saturation level. The client's greatest need is bronchodilation, which can be accomplished by administering bronchodilators. Albuterol is a beta-2 adrenergic agonist, which causes dilation of the bronchioles. It's given by nebulization or metered dose inhalation and may be given as often as every 30 to 60 minutes until relief is accomplished. Alprazolam is an anxiolytic and central nervous system depressant, which could suppress the client's breathing. Propranolol is contraindicated in a client who's wheezing because it's a beta-2 adrenergic antagonist. Morphine is a respiratory center depressant and is contraindicated in this situation. Question 29. Pulmonary disease COPD. Which nursing action best promotes adequate gas exchange? A. Encouraging the client to drink 3 glasses of fluid daily. B. Keeping the client in semi-Fowler's position. C. Using a high-flow Venturi mask to deliver oxygen as prescribed. D. Administering a sedative as prescribed. Answer C. The client with COPD retains carbon dioxide, which inhibits stimulation of breathing by the medullary center in the brain. As a result, low oxygen levels in the blood stimulate respiration, and administering unspecified, unmonitored amounts of oxygen may depress ventilation. To promote adequate gas exchange, the nurse should use a Venturi mask to deliver a specified, controlled amount of oxygen consistently and accurately. Drinking 3 glasses of fluid daily wouldn't affect gas exchange or be sufficient to liquefy secretions, which are common in COPD. Clients with COPD and respiratory distress should be placed in high Fowler's position and shouldn't receive sedatives or other drugs that may further depress the respiratory center. Question 30. Nurse Gina is teaching a client with emphysema how to perform pursed lip breathing. The client asks the nurse to explain the purpose of this breathing technique. Which explanation should the nurse provide? A. It helps prevent early airway collapse. B. It increases inspiratory muscle strength. C. It decreases use of accessory breathing muscles. D. It prolongs the inspiratory phase of respiration. Answer A. Pursed lip breathing helps prevent early airway collapse. Learning this technique helps the client control respiration during periods of excitement, anxiety, exercise, and respiratory distress. To increase inspiratory muscle strength and endurance, the client may need to learn inspiratory resistive breathing. To decrease accessory muscle use and thus reduce the work of breathing, the client may need to learn diaphragmatic abdominal breathing. In pursed lip breathing, the client mimics a normal inspiratory-expiratory IE ratio of 1:2. A client with emphysema may have an IE ratio as high as 1:4.
Thanks for watching. Please comment, like and share.